Okay, so this is the second part of the lecture on stress. This is more about really deep-seated traumatic stress, repeated traumatic stress, especially the stress that you experience as a child, and how that can lead to all kinds of lifelong issues, or not just around mental health, but around physical health at all. It can be kind of linked to child abuse or issues when you were a child. There's this definite pattern that I think you'll notice. Those maybe may have been exposed to healthcare already, or you will notice when you're out there working with clients, between early childhood traumas and health issues. I can't tell you how many times I would hear these horrific stories from clients about things that had happened to them when they were young, or loss of people, or abuse. And it's like, is it me, or am I attracting all these awful stories with patients, or is there a link here? I didn't really see the link until I started teaching and I started learning about the ACE score, study that really definitively showed this link between childhood trauma and health issues. Some of the stories that you read in Human Movement, and one we kind of mentioned last week, kind of get at this link between the trauma and childhood trauma and lifelong health issues. Remember Stacy? She was the one with the amputations. She was in a wheelchair. She was kind of end-stage dialysis. Young woman, a horrible story. Her body was kind of ravaged by diabetes from a medical perspective, but she had been abused as a child. And I think there was definitely a link between the childhood abuse, what it did to her body in terms of stress, as we talked about the cortisol, those kinds of things, and then the diabetes at an early onset, and then the diabetes kind of just ravaged her body. So stress led it to diabetes, really, in her case. Arnold, he had a lot of stress. I don't know if you remember him so well, he was kind of the obnoxious guy that had the spinal cord injury, who was verbally abusive to his wife. He had been abandoned by his family at a young age. He was alcoholic, abusive. You could see the connection there. And then last week we talked about Joe, the morbidly obese client that came into St. Joe's with my student that had him as a client, and how Joe did really well in the hospital with all that structure, socialization, and then back out on his own, just fell apart again. And why was that with Joe? He had a history of sexual abuse when he was young, so he had that ACE score connection. So again, you're going to see again and again childhood issues and lifelong patterns. We'll talk about this link, how it causes these issues, and then more importantly, probably we'll talk about what you can do about it, how there is hope. This isn't like a, kind of a death sentence kind of thing. A lot of times there's just these questions that people are seeing this link between trauma and health, and they kind of wonder, do people really get over early childhood trauma, or does it kind of linger? Is it a lifelong deal, or is it something that just happened and then you kind of forget about it? People always say kids are resilient, they can overcome amazing things. Do kids just overcome it and kind of move on with life? Why do some people continue poor health habits even when they know it's detrimental to their health? Smoking and drinking, excessive eating, that sort of thing. Why do people discontinue these habits even though that's bad? They know it's bad for them, but they can't seem to stop these habits. And usually we're talking really severe habits like smoking and drinking and drug abuse. What's the deal here? We tried all those strategies we talked about last week, and it's not working. Why is it not working? They're not really moving forward on those levels of change that we talked about, Prochaska's levels of change. Is it more deep-seated than that? I know, again, talking about my wife dealing with diet issues, people with severe diet issues. She was getting really, really frustrated. Started to hear these stories and started to realize, oh, this is really almost kind of beyond my scope as a dietitian. These people have had issues or abuse in the food when they were young, and it's kind of led to these lifelong patterns. Is the relationship between early trauma and poor health habits? All these questions have kind of been out there, and they're really kind of resolved with this study that was done. It's a famous study. It's called the ACE study. The ACE, you kind of looked at it in your homework this week, hopefully. The ACE stands for the Adverse Childhood Experiences Study. They did this research, they asked these questions that we're just kind of talking about. What is the relationship between adverse childhood events, health risk behaviors, and adult diseases in the following categories? Child abuse, emotional, physical, sexual abuse. That was probably the biggest one. Household dysfunction. The mother was treated violently, or the husband. Alcohol, drug abuse, imprisonment, mental illness. Even some of these scores, they by themselves are not necessarily a big deal, but you have a lot of them together. You have multiple scores on this, multiple categories that you've experienced as a child. It can lead to a lot of issues. One of them is a single parent, issues around not a great marriage, neglect, physically, emotionally being kind of ignored or neglected. Who are the participants in the study? They were average people on the whole. 80% white, middle class, half were female. The mean age was 57, a little bit older. First wave they did it was 8 categories of abuse, and then they expanded to 10 categories of abuse. Over 17,000 people. As you know, probably most of you know with research, the larger than what they call the N, the number of people that participate in the study, the more relevant it is. If it's randomized and it's large numbers, representative sample of the entire population, you can pretty much say it's a causal link. This shows this is caused by this. This is very, very significant. It's not a single one little study. It's a huge, very, very significant study. It was a landmark study. Repeated studies have kind of showed this again and again, that this really is, what they found was very, very true. What did they find? 1/3 had an ACE score of 0, that had no history of abuse at all. 1 in 6 had an ACE score of 4 or more. That's a lot of scores. Remember the scale, if you, the questions, if you did them for their homework. 1 in 9 had an ACE score of 5 or more. There was a graded relationship between ACE scores and health risk behaviors and disease. The more scores, the more health issues. Those with 4 or more categories they checked off for ACE score childhood abuse issues, compared with those with none. Those with 4 or more had a 4 to 12-fold increase in alcoholism, drug abuse, depression, suicide attempts. 2 to fold increase, this is huge increases. Smoking, poor health, multiple sex partners, sexually transmitted diseases, 1 to 4, 1.6-fold increase in inactivity and obesity. Number of categories directly related to heart disease, cancer, chronic lung disease, even bone fractures and liver disease are connected to ACE scores. Higher ACE scores, more likely to get those kinds of things. Results that found a connection between high ACE scores and psychiatric disorders, depression, suicide, hallucinations, amnesia, health risk related poor health habits, smoking, alcohol abuse, drugs, sexual behavior, early pregnancy, all these sorts of things. Medical diseases, this is the one that really jumps out at me. If you had high ACE scores, you're more likely to get COPD, coronary artery disease, autoimmune diseases, multiple sclerosis, fibromyalgia, all those kinds of things. Definitely increase healthcare costs, decrease life expectancy. If you had high ACE scores, you were less likely, you didn't live as long. You don't live as long as people on the whole than people that don't have any ACE scores. We anticipate that when our prospective analysis of death rates is completed, it will illustrate, and it did, convincingly that there is increasing death rate as the ACE scores increase. Women especially seem to be impacted by these ACE scores. You can make the leap around sexual, emotional abuse. A lot more women are experiencing that. Could be because of this link, health issues. Autoimmune disease, or not primarily, but more so than men, females get autoimmune diseases. Women were 50% more likely to have experienced 5 or more categories of ACE scores. We believe that there is a key, here is a key in mainstream epidemiology. appears as women's natural proneness to ill-defined health issues. These are the categories that we're like, how do we diagnose this? How do we treat this? Fibromyalgia, chronic fatigue syndrome, obesity, irritable bowel syndrome, chronic malignant pain syndromes seem to be connected to ACE scores. In light of our findings, we now see that there are medical constructs, artifacts resulting from medical blindness to social realities and ignorance of the impact of gender. So there's definitely a connection between gender, abuse, and these autoimmune kind of hidden diagnoses that are very, very real to the persons that experience them. Implications of the study: trauma in childhood and adolescence is more common than realized. Experience of early years are lifelong. Implications of the ACE study: many of our intractable public health problems are the result of compensatory behaviors, trying to deal with or not deal with the pain from the past. Smoking, overeating, alcohol, drugs. Not necessarily always the case. If you do some of these things, or if you had issues with some of these things, doesn't mean that you've had childhood abuse, but there's a large tendency that there is a connection. The chronic life stress of these developmental experiences, generalized, unrecognized, and hence unappreciated as a second ideological mechanism. What are the implications to this? Especially for us. We talked about Joe, that case where he was dealing with those sorts of things. I think in Joe's case, the student looking back probably could have or should have gotten psychiatric services involved with Joe versus just the PTOT nursing thing, treating his diabetes and his functional deficits. They needed to work on his mental health issues. He needed to see a counselor or a psychologist or psychiatrist. Administering the ACE is not something we do. It's not in our scope of practice. We do deal with the fallout of it. What we do is making resources available to children and families, trauma exposure, impact and treatment. Resilience, this is the good news around ACE scores. If you have high resilience, you can overcome these ACE scores. It's kind of like we talked about the marshmallow study. There is hope. It's not like a death sentence necessarily. That's why we had you look at that resiliency score thing too. Usually when a psychiatrist gives somebody the ACE study score thing, they also give them the resiliency score. So they can see that, yes, you've had childhood trauma, but you've kind of countered it. You're a very resilient person. You've overcome this. You're very strong. We can strengthen that resilience so you can do better and you're not going to get this death sentence of early death and all these health issues. Resilience and protective factors for children, families, and we can do that. Again, those outliers, that's the hope for us. That's the ones we can kind of improve. Remember the neuroplasticity of the brain. It's not necessarily a death sentence. We can change the brain, overcome these early environmental experiences. Facilitating resilience in our clients can make a significant difference, especially with those kiddos when they're very young. Resilience is fostered through promoting self-control, optimism, integrity, perseverance, supports, all those things we do as an OT can really have an impact on our clients. Other implications: address parent and caregiver trauma and impact on the family system, i.e. report and stop the cycle, emphasize family-centered interventions, emphasize continuity of care and collaboration across systems, i.e. communicate with other healthcare providers. It's very much a team kind of thing. You have to look at it as a team kind of thing. Don't want to be doing this, working on these issues in isolation for sure. Advocate to access to community resources. It could be something as simple as food banks, getting good 3 meals a day, housing, shelters, getting away from that abuse kind of thing as soon as possible, substance abuse support. These are the kinds of things we can advocate for our clients. These are study questions. I would like you to, if you're just listening to this, watch this first video. There may be questions on the midterm on this first video. Okay, and that is it.